consumption don't need to be changed. Well, let's try and make sense of this. I'm joined now by Assistant Professor for Microbiology and Immunology at Johns Hopkins Bloomberg School of Public Health, Jotham Suez. Thank you for joining us. So help us understand what we're hearing here, because on one hand, we're being told aspartame possibly causes cancer, but on the other hand, it's still safe to consume?
Yeah, that is correct. And two bodies have performed this evaluation. One body deals with the hazard, that's the IARC. And they are saying there is limited evidence, both in humans and in animal models, that aspartame might cause cancer. That's a potential carcinogen. But then there's an additional body of the World Health Organization, that's the JEFCA, and they're JECFA, and they're evaluating the risk, how much aspartame we need to consume to reach that potential impact on carcinogenesis. And they're saying, yes, there are evidence, but these evidence don't say that the dose should be lower than what it currently is. So it might be a carcinogen, but not within the doses that we're currently consuming.
All right, but how common is aspartame in the foods that we consume every day? Is there any way of really knowing how much of aspartame I'm getting in a day?
Yeah, so we estimated about 90% of the intake of aspartame is through diet drinks, diet sodas. And if we're thinking primarily of that as the source, an adult weighing about 70 kilograms would need to drink between 9 to 14 cans of diet soda a day to reach that dose. So maybe not entirely impossible, but also not very plausible. What has been going a bit under the radar, I think, is that for children, especially young children, that dose represents a mere number of 2 to 4 cans a day. And this is where I think we should be more cautious.
Well, that's a really important point, how different it is for children. But aside from the possibility of, carcinogens, are there other risks associated with consuming aspartame?
That's a really good question. So, of course, we're primarily using aspartame and other artificial sweeteners as means of preventing weight gain or controlling healthy blood glucose levels, preventing diabetes. And the World Health Organization has also earlier this year published a recommendation. They have called a conditional recommendation, saying that strategy might not be the best strategy. Replacing sugars with artificial sweeteners may not be the best way of preventing weight gain, preventing diabetes. So we should consider that maybe artificial sweeteners have the potential, at least in some individuals, as we are also seeing in our studies, to actually promote metabolic derangements rather than prevent them. But the jury is still out there for how common this really is.
Okay, and we do know that scientists have been asking for decades whether artificial sweeteners are good or bad for us. But if we boil it down to a really simple question, what's better for me to drink? A Diet Coke, or as I call it, a full-fat Coke?
Well, obviously the responsible answer would be you should probably drink water.
I knew you would say that, but if you had to tell me what would be better for me?
We do know that sugar, white sugar, and sugary beverages are linked to a myriad of health concerns, including carcinogenesis, or at the very least metabolic syndrome as a cause for certain types of cancer. So definitely the solution is not to switch back from diet soda to your regular sugar-sweetened soda. That would definitely not be a good strategy. I think what we agree upon, both as scientists and people in the field of nutrition, is that we should try to find a way to reduce sweetness intake across the board. Now, there are certain, I will not name names of products, but there are products that are sparkling beverages without a lot of added sugars, or without any sweetness at all, that they might be a feasible alternative to water for people that really have to drink something that feels like a soda.
Okay, thank you. I know I put you on the spot there, but thanks for answering that. And just briefly, that was Jotham Suez joining us there. If I've still got you, Jotham, I just wanted to ask, is there anything else about aspartame that you think should be studied?
Obviously, what we have seen is that the impact of artificial sweeteners may be personalized. So some people would be negatively impacted by them, and others would not. The WHO has also highlighted that in their summary that they published today. And we think that part of the reason for that is our favorite research topic, which is the microbiome gut bacteria. So our naturally occurring bacteria mediating different responses to aspartame and other sweeteners.
We'll leave it there. Thank you very much, Jotham Suez. You're watching The Context on BBC News.